Hello, Dr. Joe here, medical doctor and a lifestyle medicine expert. So, in my last video, I talked about the 65% club, which more or less means people who have resistant hypertension. And that means people who are using 3 or more high blood pressure medications and their blood pressure is still not well controlled, basically. And guess what? 65% of hypertensives, i.e., individuals who have got high blood pressure, 65% of them belong to this club. And it's been a problem. And I gave a reason the last time. And this very video is for the second reason, okay? The second reason. And what is this reason? Well, over the years, I've come to realize that, and by the way, this is going to really hearten you because it is due to circumstances that are beyond your control, okay? So I did talk about the fact that people are too reliant on medications the last time. That is to say, they're not really doing anything to alter their lifestyle. So that's one reason, and it is a genuine reason because I coach people and, I see these things. But something else I've noticed as well, and this is an organic problem that is underdiagnosed. And it's probably because we don't look for it hard enough, okay? We don't look for this condition hard enough. Like I said, this is going to hearten you because it is an organic problem and it is beyond your control, okay? It is beyond your control. So what am I talking about? Well, it's got to do with a hormone that comes from the adrenal glands, okay? There's a hormone that comes from the adrenal glands and it's called aldosterone. That's the name of this very hormone, aldosterone. And this hormone is a pain in the neck, I have to say. And as far as high blood pressure management is concerned, it is a pain in the neck. And, we don't look for it hard enough. And that's the reason why it is underdiagnosed. So it's called primary aldosteronism. Okay, that's the condition. So what that means is you are secreting too much of this hormone. And if you're secreting too much of it, then it's going to be hard for those medications to do their job. All right. They're going to try their best, but they will be swimming against the tide. And that is the real problem here. So what does this hormone do as far as blood pressure management is concerned? Well, the problem with it is it leads to this aldosterone hormone. It leads to salt and water retention. Okay, salt and water retention. And anything that makes you to retain salt in the body, okay, because once salt is retained, water is going to follow. The net result of that is you have a higher blood volume. And that means your blood pressure is going to remain high, regardless of what you do. So that's why I said this reason will sort of hearten you because it's really due to circumstances beyond your control. And my view is that we're probably not looking hard enough for it. So we don't tend to diagnose it. But I've got some good news for you. And that's going to be the subject of my next video. Okay, I'll talk about, some good news that is in the horizon. Okay, there's good news in the horizon for those of you who have got this condition. I'll just leave it at that for now. Okay, I will talk about that reason, or rather, the hope in my next video. Okay, for those of you who have got aldosterone problems, as in high aldosterone problem, there is hope in the horizon, and that's what I'm going to talk about in my next video. For now, remember the mantra for this very channel is for us to stress less, and smile more. Okay? I repeat that. We stress less, and then we smile more. So do follow, subscribe, leave your comments below if you belong to this very club. I'd like to hear from you. Dr. Joe here, signing out.